I think we all hope that most people are having a beautiful end of life experience, however long that takes, whatever it looks like. I think we all hope that we're probably going to have the deluxe experience, and that our friends and neighbors and family are also. What percentage of people are falling in a crack, roughly, do you think?
Most. A lot. The most.
Yeah,
Most?
I would say most.
What do you want your final years of life to look like? It's a big question, but a pair of McMaster-affiliated doctors in Hamilton are hoping to leave us more capable of crafting that answer for ourselves. Samantha Winemaker is a palliative care physician. CN Xiao is a professor and researcher. They've teamed up on something they call the waiting room revolution, effectively using every medium they can to start a social movement aimed directly at patients, where those receiving a life-changing or life-limiting diagnosis actually know what questions they should be ready to ask their doctors. The pair have hit social media hard, launched a podcast, and most recently published a book. It's a journey they embarked on together after noticing a very specific problem.
Over and over and over and over again, we realized that patients and families, even at the end of an illness, didn't really fully understand where they were at in their illness and what to expect going forward.
Whose responsibility is it to avoid that? Is that the patient, or is that supposed to fall on the physician?
Our training as healthcare providers has major gaps when it comes to talking openly about progression of illness. And so ideally, I think it is the responsibility of healthcare providers. However, we are realizing that we can't leave it to healthcare providers who feel very uncomfortable having those conversations.
We know that there are well-meaning providers and really great hospitals that are doing their best, but it's not enough. We as patients and families also have to take an active role in telling them what it is what we need and want.
The decision to go right for patients, for education and outreach. Has there been some other effort or some other team out there that's been trying to educate the healthcare providers?
Oh, I'll say yes. Yeah. There's I think there's decades of research and really great programs in Canada, all around the world, that have been focused on training healthcare providers. But after all these years, the needle is not moving fast enough.
We are seeing the same scenarios still over and over and over again.
When you started to have this conversation where you were reaching out directly to citizens with mentorship and training about how to go about this, did you find that was controversial among your fellow medical colleagues?
Well, I was worried about that, to be honest with you, because it felt like we were, exposing what was happening behind the curtains of healthcare, like the exposing the dirty laundry, so to speak. But the opposite has happened. So once we came out with our social media and our book and our podcast, the surprising thing has been that healthcare providers have thanked us.
There are a lot of us who want to go to our healthcare provider and feel like we are being a good patient. But we may be doing so at our peril, is the sense I got from you there.
Well, you can be respectful and you can be polite and you can be good in many ways. However, what we don't want patients and families to do is to be completely passive or nonchalant or go with the flow.
So many patients and families didn't know what they didn't know, and once they realize that there are questions that they can ask that gives them this information and this power back, and sharing this power with their healthcare provider, it is a game changer.
What should patients be asking instead? What should they be saying to their doctor to make sure that they can have that like an optimal experience?
Offer to the doctor that they are the kind of person who wants to speak openly about their illness, and give the doctor permission to speak frankly with no sugar.
And I think what we find is both sides are trying to protect each other. You don't have time to talk about it. You're worried that you might take away hope.
Some doctors are waiting for permission actually to speak openly.
It's really about the entire illness experience, this whole chapter, whether you will die from it or not, or when that is. People may not want to plan for their death, but they do want to be prepared and in the know throughout the whole journey. And I think that's what this information is really trying to do.
It is and can be a miserable and very scary experience for people, and it doesn't have to be.
Even if you can't change the illness, you can change the experience.
This, of course, is a big topic with many more parts. To learn more, you can search the waiting room revolution on your favorite browser. In Hamilton, David Zura, City News.